Guys, my name is Dr. Kyle Daigle here with Neurosolution Center Dubai, and today we're going to be talking with Jessica, who's a colleague of mine. We're going to have a nice kind of conversation talking about mold, peptides, regulators, and how it can actually impact someone's brain.
Hi, Dr. Kyle. I'm Jessica Alanna, and I'm a biomedical scientist, and I specialize in peptide therapy, immunocompromisation, and mold illness, and it's so nice to be here with you.
Thank you so much.
So, mold illness, you work a lot with that. So how would you define mold illness?
So I think that we first start off is molds, it's everywhere, no matter where you go, especially here in the desert that you're actually seeing mold. So mold is actually an environmental trigger. It actually is known in research, we call it mycotoxin exposure. But what's happening is that our sinuses are directly connected to the brain. So when we breathe in this environmental pollutant and our body can't basically detoxify it, it can directly impact the frontal lobe and accelerate degeneration. So you're seeing patients with multiple sclerosis, seizures. A big, huge thing is autistic kids, even into Lou Gehrig's disease, and then even assisting into autoimmune disease with this whole gastrointestinal kind of gut-brain connection issue.
They say that around 1 in 5 individuals have a genetic susceptibility to mold, and this is on chromosome 6 on the human leukocyte antigen gene. Do you agree with that? Because there's some doctors that say this is true, i.e. Dr. Shoemaker, and then there's other doctors who say that this is nonsense, like Dr. Andrew Campbell. So what would you say?
I think that it's probably even more than just 1% of the population, when it's my opinion.
1 in 5?
Yeah, I would say that, I think that you even go into MTHFR variances. Those patients have a hard time, which is all of your ADHD autistic kids. The other thing is HLB27. Those are some common, demographic of patients that I've seen. So, I think the research, people are a little behind, especially from a diagnostic standpoint. But yeah, I think way more people are impacted by mold exposure than people realize.
So it's estimated to be 20 to 25% of the global population. But actually, the CDC estimates that 70% of homes are moldy. So when you take 70% of homes are moldy and 25 to 20% of the population having the HLA, it's a recipe for disaster.
1,000%.
So how does the brain stem actually become interrupted by mold?
Okay, so it's interesting. You have your trigeminal nerve, which is a nerve that's going to innervate the sensation of your face, also your front 2/3 of your tongue, but it innervates your sinuses. So what we're seeing is that if you go back and look at a child's development, we're actually seeing that these people that are impacted now with mold exposure typically had some sort of colic or some sort of developmental delay. Maybe they were spitting up. Maybe these kids had autoimmune issues, maybe even had eczema. And so what happens is an environmental trigger gets in, and anything inside the nose or the sinuses can basically directly impact the frontal lobe. So there's an area in the frontal lobe called the basal ganglia, which is where all of our involuntary movements come from, or even our reaction times. So patients who develop something called muscle fasciculation, muscle twitching is a common thing to see from mold exposure, headaches, migraines. Another thing you actually see is pupillary dilation. Patients with mold exposure oftentimes have really massive pupils. The other thing that you can see is the tongue. The tongue, you can get this white coat on the tongue. And anything that gets into the brainstem, specifically the trigeminal nerve, that runs the whole brainstem. So patients can actually see these dilated pupils, but then they can also get something called a startle reflex, where they get anxiety, loud noises, sound, bright lights cause anxiety. They also startle really easy. So these are people that you walk up and you scare them and they freak out. It's called a startle reflex. The other thing is even head tilts. Patients actually can get a lot of inflammation in their sinus, and it can impact this nerve right next to it called the vestibular cochlear nerve. That nerve regulates your postural tone. So that also controls your head. So when you look at people, you can see actually a head tilt or even dizziness, ringing in the ears, vertigo symptoms. And then the other thing is cardiac issues, high blood pressure, patients with tachycardia, high heart rate, irritable bowel, constipation issues. All of these things could actually be impacted by mold exposure impacting the brainstem.
Yeah, so we would call this chronic inflammatory response syndrome, which is classified as a multi-system, multi-symptom illness, and it's caused by a biotoxin. That biotoxin is commonly known as a mycotoxin, which comes from a live colony of mold. So everything you described perfectly fits into the multi-system illness.
Yes, absolutely.
So how would you go about diagnosing someone with mold illness and chronic inflammatory response syndrome?
Okay, so one of the things that I see that's not necessarily from a research perspective, but just from years of clinical experience, I run QEEG, so I actually look at the electrical activity of the brain. And what we're seeing in a lot of these patients with SEERS is almost every single brain wave that we test, so delta, alpha, theta, beta, even high beta, the frontal lobes are lighting up extremely red, which is hyperactive. So we can actually see from looking at scans, we're seeing this. The other thing that I do from a laboratory standpoint is we run stool samples, we run urinalysis, we run a mycotoxin exposure. And then the other thing, I run something called a Neural Zoomer Plus from Vibrant America. And from that, what we're seeing is gastrointestinal inflammation. We're seeing even an organic acid. We can even see fungal, infections and mycotoxin. It's really wild, especially working with European patients. The level of mycotoxins that we're seeing in the urinalysis are pretty astronomical. So those are some common things. And then another thing is I actually look at pupillary dilation. So I have this vision diagnostic test where I'm looking at pupil size, also something called fixation, how well the eyes can actually focus, because a lot of mycotoxin really like to target dopamine receptors. So we often see dopamine actually becomes an issue in these patients with mold exposure.
And once you have confirmed a mold illness, so once you've confirmed chronic inflammatory response syndrome, what is the first point of call for treatment?
All right, so we can have a couple things. First thing is I look at brain waves. So I tell people that you can't really rest and digest or even detoxify in a very fight or flight state. So we alter brainwave activity, try to calm the brain down. So we use stuff like photobiomodulation, pulse electromagnetic frequencies. So we'll do that for the head. The other thing is retain primitive reflexes, or in adults, we call them return reflexes, that we make sure that none of these reflexes are present within any of these regions in the brainstem. The other thing is vagus nerve stimulation. So we do a lot of cranial nerve stimulation. The vagus nerve is going to help activate the immune system. It's also going to help detoxify. And trigeminal nerve stimulation, we want to really strengthen up the sinuses. Something very interesting is that there's research that actually supports that trigeminal nerve stimulation actually releases VIP, which is something I guess we'll probably talk about.
Vasointestinal polypeptide.
Correct, from trigeminal nerve stimulation. So you can imagine if you have potentially mold exposure and your trigeminal nerve is getting weakened, which a lot of people actually who have mold exposure don't have very good facial tone. Okay, you'll also see histamine reactions, redness and stuff throughout the skin. I'm very big into the gut health, so we do a lot of photobiomodulation to the actual gut. Also for liver, I'm a very big fan of detoxifying these patients. So we'll use devices, for example, like the biocharger, something that's going to support mitochondria. Obviously, that's actually something to drive energy production in the body. We'll do saunas. I'm even a fan of even doing cold exposure. So we'll even put patients literally into, cold thermogenesis, just to be able to try to help spike their dopamine production. And the other thing is I'm very big in circadian rhythm biology, because a lot of these patients with mold exposure don't sleep very well. So, actually incorporating sunrise and sunsets, if people can't do that, we actually have devices that we can put a patient in and actually literally recharge their circadian rhythm through light.
It's really funny you spoke about VIP, vasointestinal polypeptide, and also alpha MSH, alpha melanocyte stimulating hormone. So these two neuroregulatory peptides, I test for them, and they're always completely knocked out in individuals with mold illness and SEERS.
Yeah, so well, let's talk about VIP because I've personally went through a really bad mold exposure. I was working a lot in Europe, back and forth, jet lag and not necessarily, I'm working 12, 16-hour days. And I really got hammered with mold exposure. But that was one of the things that I actually found that helped me out quite a bit was actually intranasal VIP sprays.
How long did you do that for and what dosage?
I don't know the dosage that I was doing, but I was doing typically 2 to 3 sprays for about, I want to say close to 2 months.
Okay.
Yeah, but, that's something, asking you about VIP, like, what are the benefits? What do you think about VIP?
So if you look at the research of Dr. Shoemaker, in peer-reviewed journals, he will say that VIP corrects the brain atrophy in mold. But then if you look at the research of Dr. Kent Holtorf, he actually says that VIP can be more inflammatory to the immune system. So there's a two-sided argument there. Personally, I think using VIP and only VIP is rather outdated. And I think using something like cerebrolysin, Semax and Salang is better than VIP. Because when you use VIP, all of your other inflammatory markers must be within the normal range, or you can cause immune dysfunction. So VIP, it's very complex to use, and often people go years without having their inflammatory markers at the correct level.
I was actually doing IV cerebrolysin with methylene blue in combination, so I felt that was something that was incredible for my recovery.
Even cerebrolysin is argued against, so some people say that the research is a sham. But personally, in my experience, we've seen so many life-changing stories from cerebrolysin, so I'm a pro cerebrolysin girl.
What about methylene blue?
Methylene blue, I love as well. I love to.
Yeah, well, could you tell me a little bit on your perspective about, methylene blue or, what you've seen from a, scientist aspect?
So methylene blue, it donates electrons to the electron transport chain of the mitochondria. And this basically unclogs the oxidative phosphorylation chain of the mitochondria. So when you unclog this very specific biochemical pathway, you have greater ATP output.
So what about this? Can we talk about mitochondria?
Sure.
I love mitochondria, but in your line of work, working with patients, especially ones that you've seen with mold exposure, is targeting mitochondria, is it a great thing, or what do you do in patients with mold exposure?
So people with mold exposure, they tend to be hypometabolic at the level of the cell. So the mitochondria is often in cell danger response. This can be to a few different reasons, either because the body doesn't have enough thyroid, so T3 and T4 entering the cell, and also a very specific process called immune activation of coagulation. Have you heard of this process? Yes. It's when there's too much fibrin around the very small vasculature in the capillaries, and this actually blocks T3 and T4 entering the cell. So people can have, on their blood work, it can look normal, but actually at the cellular level and subcellular level, which is where the mitochondria originates, you can be hypometabolic.
Yeah, that's interesting. One of the big things that when I'm working with these patients with mold exposure is that I kind of go back to their living environment and I ask them, how much sunlight are you getting on a daily basis? And then that comes out to, well, I'm so sick I can't get out of bed. I basically stay inside. And, from a photobiomodulation background and how I treat patients, I think everyone needs sunlight. And, I always break out the equation E equals MC squared and tell them that, your energy is going to be determined based off of the full spectrum of light to your whole entire body. And I've seen that here, in the Middle East, that a lot of the patients when I test, they all have vitamin D deficiencies. And it's obviously so hot out here, but people aren't getting exposed to full spectrum light. And everyone's staying inside. And, I think that you're seeing, there's so many coffee shops, everyone's drinking energy drinks, or even, a lot of methamphetamine usage, and it's because no one has energy.
Really?
And yeah. I mean, I've seen patients, well, not necessarily people from here, but people that expats that have actually come here, that especially in Europe or even Americans, that methamphetamines are actually something that they're on methamphetamines to drive their dopamine. But they
Oh,
don't
I didn't
realize
know
what's
that.
underneath that is obviously, ochratoxin A, strep A. These are things that we're finding that block dopamine receptors. So, these patients who don't have enough of energy, or they can't think, or they're even having balance and coordination issues, or no motivation, or they're depressed, you see their dopamine levels are low. But then the question is well, why? And for us, what we're seeing is clinically mold exposure has a, impact on that as well.
I would say that mycotoxins allows the body to become more of a host to opportunistic pathogens. What would you say?
Yes, I totally agree.
EBV, CMV, Candida. Do you see experience with this?
I do. Yeah, I think it's I think that's it's not all about mold exposure, although I think that my personal opinion that mold has a pretty big punch. But, when we're running neural zoomers and looking, we're seeing cytomegalovirus, Epstein-Barr, even herpes viruses that we're seeing in these patients. So, I think that's where it's important, from my behalf, what we do is we really work on actually looking at the frontal lobes. Because what we're seeing is the left frontal lobe drives your Th1 pathway, which is how you're going to fight off infections. And then your right frontal lobe is going to deal with your Th2, so how you regulate B cells, your immunoglobulins. So if you have, mycotoxin exposure or something, even strep in your sinuses, that could actually directly influence your frontal lobes in a negative way. And you can take all the vitamins and minerals and do, all the biohacking techniques, but if the frontal lobe is constantly under attack and it's underactive, then if you're not doing functional medicine or these things, you're really going to really progressively get worse. Whereas, where I like working with you is because it's kind of a combination to where, you need the brain and you need the brainstem to really work, because that's going to be the powerhouse which is going to drive your immune system, and then your vagus nerve is going to innervate, your spleen, your thymus, your heart, your lung, your kidneys, your liver, and your gastrointestinal tract. And then if you're running all the right labs, taking all the right nutrients and even peptides or any other type of treatment modality you're using, you're really kind of giving the body its whole kind of approach to be able to recover, because it's not easy to fight off mold exposure.
No, it's not easy at all. People suffer for many years. Many years. It's very sad, actually.
Yeah, well, let's talk about EMF. What about EMF sensitivity? You see
Electromagnetic field?
Yeah.
Yeah, so mold will grow 100 times more in a high EMF environment. And this is a peer-reviewed study. You can find the study on PubMed.
Yeah, well, and I think that's what's interesting, because I work with some patients that, they tell me they went, for example, to the Dubai Mall and they freak out. They have their heart starts getting palpitations, or they start developing histamine reactions. And, again, you walk into a place you have mold mycotoxins inside your body. You go into a place with a lot of Wi-Fi and, everyone using their cell phones. That can actually literally exacerbate the mycotoxin stress response.
Of course. So if you do have a living colony inside of you, then the EMF are going to drive the fungal enzymes and allow the fungus to metabolize more. This is proven. It's all on PubMed.
Oh, that's crazy. What about multiple sclerosis?
Multiple sclerosis. So actually the mycotoxins, they'll damage the myelin sheath to the point that you can develop MS. So there's a lot of literature on this. One of my favorite papers is by Dr. Andrew Campbell.
Yeah, I've seen that a lot with patients. It's interesting because when you look at multiple sclerosis, you typically will see visual disturbances. You also see equilibrium, so their vestibular system gets off. The vestibular system controls their postural tone, also their lower leg anti-gravity extensors, what holds them upright. And then you start seeing gastrointestinal issues, whether it's irritable bowel or even constipation.
So if I was to present a case study, so we have a 4-year-old male, well, 4-year-old boy, child, who has autism due to a high level of biotoxin. What would be the 1, 2, 3 that you do to either diagnose or treat him?
Okay, the first thing that what I've seen from autism and nonverbal is ochratoxin A obviously has been pretty prevalent. And ochratoxin A targets dopamine receptors. So most of the time, these kids' frontal lobes are going to be really, really underactive or even hyperactive, depending on the inflammatory response. So I really love doing a QEEG. I just want to look at the electrical activity of the brain. So that's the first thing, and that's going to give me an idea as to what's active in the brain, what's basically hyperactive, and I want to go after the underactivity. So based off of the brain, I can see, do I need to basically do a lot of sensory stimulation? Do I need to do, temporal lobe stimulation like smell, music? Even frontal lobe, do I need to do lots of sensory stimulation to using like the eyes or the cranial nerves, the senses? Then I do primitive reflex work. So there's something called the foundational primitive reflexes that we look for. One, the moral reflex, which is this kid sensitive to light and sound in crowded places? The next thing is this kid nonverbal? Is this kid a picky eater? Then I'm going to look at something called the rooting reflex. Then I'm going to look at their hands. There's the baby reflex called the palmar, when you take your finger in a baby's hand and they grasp it. Okay, well, the problem is that's supposed to go with age about 6 to 8 months, and these kids still have this reflex. So you're seeing fine motor issues, speech and language issues from that. The other thing is their feet. We'll check something called the Babinski reflex. And so I'll go through looking at all the foundational primitive reflexes. So I'm looking at the brain, looking at the actual primitive reflexes, and then I look at the cranial nerves. I want to make sure that their vagus nerve, which is going to be what's going to activate their immune system or allow this kid to detoxify. And once I find that, I'm going to target the brain. I'm going to address these retained primitive reflexes, and then I'm really, really going to focus in on their vagus nerve to help this kid either fight off infections or potentially detoxify.
And you said smells, so which smells would you be using here?
Yeah, well, what I like to do if I can, I like to put a pulse ox on the kid. And it's very interesting because I can actually try and use different senses. For example, the left side, the nostril, which is going to drive the left frontal lobe. We might use something like rosemary or like orange or strawberry. And those kind of pleasant smells drive the left frontal lobe. And then for the right side of the brain, we might use stuff like peppermint, eucalyptus, lavender. But it's really interesting because I can actually literally take a pulse ox and I can put it on the patient and I can try the individual sense and I can watch what happens to the autonomic nervous system. So if something's favorable to actually enhance the brain function, the heart rate is actually going to reduce and the oxygen saturation level is going to go up. So I can actually see sometimes it's smell on both sides of the nostril, sometimes it's just one. But it's interesting that when you look at an autistic kid and you look at their face, their right side of their face, this thing called a nasolabial fold, is oftentimes typically pretty flat. And if you take their head up, you'll see that their nostril also is not as big as the one on the left side. So most of these kids are actually mouth breathers. They're not breathing through their nose. And the whole purpose of breathing is actually breathing through your nose to get oxygen to the frontal lobe. So MRI studies of these kids, if a parent does that, we're actually seeing mucosal thickening in the frontal and maxillary or even ethmoid sinuses, or even calcification. So you see mucosal thickening, radiopacifications in the sinuses. So these kids' sinuses are so congested or even calcified that they can't even actually breathe through their nose. And then the other interesting thing about these kids is if they can't smell, they're typically not going to taste. So these kids are picky eaters, and all they're eating is carbs. Buttery noodles, pastas, crackers, pizzas, mac and cheese, cereals, candy. And what I've actually found is that if I actually, what I do with these kids is really neat. I'll actually take peppermint powder and peppermint oil, and I actually rub the upper surface of the actual mouth. And what happens is these kids, actually, you start seeing them kind of like take a deep breath in. And a lot of these kids have so much inflammation in their sinuses that they actually have like tartar buildup and they can't actually breathe through their actually nose, but they also they're not even able to actually taste and actually smell at the same time. So at the top of the mouth, you have these two little holes and they actually get clogged. And we'll use this peppermint or peppermint powder to try to open it up. And then what happens is that the kid starts smelling, then obviously that's going to assist in their digestive system. The kid starts tasting. Well, taste is a very important cranial nerve that the brain uses for speech regulation. It's called cranial nerve 7. So there's 5 nerves for speech: 5, 7, 9, 10, and 12. So, in speech therapists, they're working on these autistic kids, but no one's actually addressing these cranial nerve deficits that bring all the sensory information to the brain. And I think that mycotoxins have a significant play in blocking this, as well as the whole genetic aspect with these kids.
Yes, I would agree. And hyperbaric oxygen, which is oxygen under pressure, hyper meaning increased and baric meaning pressure. Do you use this a lot in your practice? Because I love hyperbaric oxygen, and I worked with hyperbaric oxygen for around 2 years in London.
Yes, well, I did. I had it in one of my practices back in the States. We used it, had phenomenal results. Some of the kids that we had sometimes were getting inner ear infections from that. And, I was telling the parents, it's very interesting when you look at, what's going on here. Oxygen is obviously healing for the brain, and it also reduces inflammation. But the trigeminal nerve right next to that is actually the nerve for the ear. It's called the vestibular cochlear nerve. So if you get inflammation in the trigeminal nerve, that goes to the same area in the brainstem where the vestibular cochlear nerve is, where your hearing is. So sometimes that anti-inflammatory response might surface into a symptom, and that symptom might be inner ear infections. But no, I'm a fan of hyperbaric oxygen. Even just using oxygen, from even oxygen concentrators are even huge. Just a lot of these kids, when we test them, their oxygen saturation is like 94, 95. And you also see, very interesting, that their posture is off. They have like a flex posture. We call it upper crawl syndrome. And the whole purpose of the lung is the lung needs, surface area to expand to get oxygen for the brain. So if these kids basically have this forward slump posture, the lung capacity is not expanding, so they're not getting enough of oxygen to their frontal lobes.
So hyperbaric oxygen, it actually increases the oxygen concentration within the blood plasma, the cerebrospinal fluid, and the lymph up to 12 times, so 1,200%.
Yeah, it's amazing.
And it's also very good for the mitochondria, the gut, and also repairs brain atrophy as well.
Yeah. You mix that with some methylene blue and photobiomodulation, and that's a incredible recipe to help heal someone.
And cerebrolysin and peptides and bioregulators too.
Yeah, well, let's talk about that. It's a new thing about bioregulators. So literally right before I came here 2.5 months ago, one of my functional medicine doctors called me and he was like, hey, have you seen these bioregulators? So, what is a bioregulator?
So a bioregulator is an amino acid between 2 and 4 in chain length. And actually it's all Soviet Russian technology. So it's new to the West, but it's not actually new in terms of the research. So Dr. Kavinston, who passed away this year, he has all of the patents in St. Petersburg for all of the bioregulators.
So, well, let's talk about that, because I literally, before I left, we bought all kinds of stuff for CNS. I think that there was some liver. So what are some of your favorite bioregulators pertaining to patients with mold exposure?
So bioregulators, it's all about the charge of the DNA and then the amino acid sequence of the bioregulator. So all of the bioregulators are made from cattle, and they can only act on the DNA sequence of the amino acid of its origin. So the liver bioregulator, it acts as an epigenetic switch for the DNA of the liver because its origin is that from the liver of the calf. So that's the key mechanism of the bioregulators. They can enter the nucleus via the nucleopore and actually act as epigenetic switches, which I think is really amazing. So my favorite bioregulators are central nervous system, thymus, pineal, and also the liver as well. But you must combine every single bioregulator with the blood vessel bioregulator. I don't know if you knew that.
I did not.
Yeah, that's the combo.
The combo.
You must combine all of them with the blood vessel bioregulator. That's the foundation.
So patients with mold exposure, let's talk about it more from a detoxification issue. So a lot of these patients, they've, made claims that they started trying to detoxify, they did these things and they felt worse. What do you do for patients with detoxification issues?
So essentially this group of patients, they have a defect on chromosome 6 on the human leukocyte antigen gene. So their innate immune system is not able to correctly identify and tag the mycotoxin. So they can't create the correct antigens to detoxify the mycotoxin. So the mycotoxin is never conjugated into the bile and evacuated through the stool. So that's the main detoxification issue with these patient population.
And what are some things that you might typically, from a patient perspective, like what are some type of, is it peptides, is it glutathione? What are some things that you try to do to support those?
So you can use binders. So you have to use binders because you have to remove the antigen. So you do have to reduce toxin load. However, for a majority of people, binders isn't really enough, and you need something to go in and halt the inflammatory immune cascades. So this is where I would use a signaling molecule, such as a peptide. So peptides between 4 and 50 amino acids in chain length, and they actually dock to receptor proteins, and they initiate an intracellular signaling cascade. Now this cascade, it changes the physiology of the body in a positive way, and therefore people feel better because their inflammatory cascade is being halted by the peptide.
So binders, that was something that when I was going through mold exposure was huge. And I noticed, though, that there was multiple binders I was trying. One, I tried like bentonite clay, zeolite, and then I happened to get into fulvic and humic acid, and I felt like I responded a lot better to that. Is, first of all, what is a binder?
A binder is a substance that has the correct charge to actually bind the mycotoxin and remove it from the gut, from the cell membrane, and from the blood, conjugate the mycotoxin to the bile to be evacuated into the stool.
So, and what are your kind of favorite binders to try to use?
The peer-reviewed binder is cholestyramine. Have you heard of this drug,
Yes.
cholestyramine? So on paper, it's used to reverse cholesterol, but Dr. Shoemaker in 1998, he discovered that cholestyramine is the perfect mycotoxin binder. However, it does come with a lot of side effects, so some people prefer to use holistic binders like clay and Cellcore. You love Cellcore, right?
I do.
Yeah, so Cellcore and some of the other binders that you mentioned.
When I was doing my mold detox, I can't pronounce it right. How do I say it?
Cholestyramine.
Yeah, so that
Did
was
you try that one?
Yeah, I did. I tried it, and my internal medicine doctor was like, "You have to take this stuff. It's awesome, but it's going to be like a gut punch." So I tried it. Did not like that whatsoever. Actually, felt worse. And then this is where kind of my love for Cellcore came up, was mainly for personal experiences. That as soon as I started taking like the biotoxin binder. I was doing a lot of sauna therapy, but it just made a massive difference in my overall symptoms. So what about histamine reactions?
So histamine, it comes from mast cell. So it comes from the degranulation of mast cells. And I actually believe this starts in the brain. So a lot of people will try to treat histamine by taking supplements. But actually using epitalon peptide, I have seen to be the best mast cell inhibitor.
Really? Yeah, that was something that, I had a really severe head injury in 2013, almost died. And
I'm so sorry.
It was horrible. But after that, kind of started my journey of getting sick, because here I was a perfectly, healthy person, exercising, doing all the right things, get a brain injury. And then I was working in and out of Europe and, exposed to mold from all the old buildings. And then boom, I get so sick I can't get out of bed. And that was something that happened with me, is started developing histamine reactions. Now, again, I was hit on the right side of my head, which is where the right frontal lobe controls B cells. So I started having issues, and I was personally taking DAO enzyme that seemed to kind of help. But the big thing that really drove to reduce histamine was actually photobiomodulation to my actually head. And I noticed that if I was actually lasering my head every day for 2 to 3 minutes, my histamine reactions would be so much better throughout the day. But yeah, I see that a lot with patients with mast cell issues, that, they get these big red rashes, or if they get really stressed out, they just, get like this big flush.
Yeah, it's very common, especially for people who have an internal colonization of mold.
Yeah, different peptides. So which one's your favorite? Well, let's just do this. All right, so let's kind of go through, I'm big into biohacking.
Okay.
I built like a whole biohacking lab at my house. Sound beds, PMF beds, light beds, oxygen therapy, even bought a Rife machine for myself personally. I'm doing a lot of stuff.
Oh, I want to try that.
Yeah, it's amazing to see, sound healing is crazy, or even using specific frequencies. But peptides. So what are some peptides that would you suggest, from a biohacking? I want to, I'm a business guy, so I travel a lot, don't sleep near as much, but I also know that stress comes at a price. So what are some type of peptides that I could use to potentially, maybe biohack my mind or even my mitochondria?
I would say thymosin beta 4 because it's a double-edged sword of positivity. So some of the amino acids in thymosin beta 4 are going to work on the thymus to improve your immunity. And the other amino acid chains are going to be very anabolic. So they're going to help rebuild tissue, they're going to act on actin and myosin, which are very specific cells within the muscle tissue, going to repair the blood-brain barrier, going to repair the gut, and also you see an improved immune response. So everyone loves BPC, but I prefer TB500, otherwise known as TB4.
Yeah, I was a BPC from once I kind of got in the peptide world. I started taking that and I enjoyed it. But what about this? Let me ask you, patients who start detoxifying and their blood-brain barrier is open. Is there anything that you do with patients about addressing that versus, someone runs a stool sample, they see they have leaky gut, they start detoxifying, they feel worse, and then we come in to find out their blood-brain barrier is open. Is there any type of peptide or type of nutritional support that you recommend for that?
We would use lorazepam, which is an oral peptide. It's known to close all leaky barriers, including the gut and the blood-brain barrier. Then we'd use BPC-157 for angiogenesis. This is also going to close the blood-brain barrier, and also TB500.
What about the difference between oral peptides versus intranasal?
So oral peptides, they work to around a 20% efficacy, and they're only localized to the gut. So you're looking at oral lorazepam, and lorazepam, it's made to be oral, so you cannot find an injectable or intranasal form of lorazepam. Oral BPC also works very well for people who have gut issues. Intranasal, we're looking at KPV, Semax, Salang, and these are actually used intranasally. So especially Semax and Salang, it's not meant to be injected, it's made for intranasal use.
What about NAD?
NAD, I love NAD. I've had a couple of NAD IVs and I find them very enjoyable and very energizing.
Yeah. What about intranasally NAD sprays?
I would prefer injectable and IV. That's what I would prefer. Maybe you have different opinion.
I feel like for me, I try everything, but I did notice though, doing NAD nasal sprays, I felt like I had quite a bit of energy, with a little bit that I was using it.
I'll have to try.
Yeah, it was interesting.
So if someone came to you with cancer on the brain, because I know you do treat these types of people, what would you do?
Okay, so one of the big things that from a research perspective in the literature, the left frontal lobe actually controls TNF, tumor necrosis factor. Also, the left vagus nerve controls TNF. So I think that from doing scans, what we're going to see is that the left frontal lobe is typically going to be underactive. So the next question is detoxification. Can the liver actually detoxify? What does their glutathione look like? So I kind of steer away from the actual cancer itself because the body's self-healing. So the goal for me is to actually target the left frontal lobe, look at the left brainstem, facilitate activating detoxification pathways, and then finding the infections. And what I found a lot of times with brain tumors is it goes back to mycotoxin exposure. I'm seeing gliotoxins, Roaridin A, ochratoxin A, Stachybotrys. The other thing too is that we're noticing that they have these return reflexes. So the moral reflex is a very common reflex. One, these patients have anxiety because they have a diagnosis of a brain tumor, and the only thing their brain can think of is the prognosis is basically death. So what happens is they're in fear. And, when you basically relax or you basically are at a restful state, your digestive system can work. So these patients try to go into a whole diet modification issue. They start trying to, maybe start juicing. Maybe they go into a full plant-based diet. Those are all great things. But if the brain's in a state of stress, meaning that the brain waves are altered, you got to calm the brain waves down. And then I'm very big into manifesting. So a big thing for me is to try to, teach people a concept of interoception, that, their brain actually and their immune system can do a lot of powerful things if they're in control. So we actually have that patient go into, it's actually a video game that I made personally, is I made a video game that you're in complete control and you're going through and you're literally zapping pathogens in the body. And obviously you get cancer from typically, underlying infections, the body can detoxify, heavy metals and all that. But we try to teach these patients that, they could potentially be in control of their own health, but it all starts with controlling their mind. And then it's really being very mindful as to controlling their thoughts, what they're putting into their body. And then I'm a very big fan into sauna detoxification issues. There's kind of a whole system with trying to reduce, I call it the C word. My mom had triple negative breast cancer, and she opted to do no chemo, no radiation. And she basically came to me for all the help. And what we did is we ran the full panel and said, look, let's find the underlying issues. We scanned her left, we scanned her brain. Again, found out the left frontal lobe was underactive. Her left vagus nerve was completely underactive. And you can actually look in the back of your throat and you have your little uvula, little hangy thing, and then there's these arches next to it. Well, you want those arches to be symmetrical. And what you typically see in these cancer patients is that if there's a really strong infection going on, the arch is actually going to be really low on the left side. And then if you see it flipped where it's lower on the right side, that patient's having detoxification issues. And you can quantify that by running labs. And you're going to see that, they're going to have, run lipid panel. You're going to have a bunch of liver markers, alkaline phosphatase issues. You're going to see glutathione is going to be literally zero. So these patients can't detoxify. And then you ask them, can you sweat? And they're like, no, I go outside, I can't sweat, but I sweat at nighttime. And, that's a very common thing that you see is night sweats, but you don't sweat when you're outside. And there's a lot to that with their brain. But that's one way that, I would address that is not necessarily going after the C word, but actually driving the brain, treating the immune system, and then facilitating their detoxification. And then I'm a big circadian rhythm guy, so I do believe that people need to get outside, watch as many sunrise, sunsets, and grounding. I think it's a very free type of treatment that people can do is actually getting outside and actually physically grounding to allow them to, basically detoxify.
I'm always wearing my blue light blocking glasses.
Yes.
For me, I have to.
Yes. Well, I think that's something that people don't realize. I own a tech company, and I actually have quite a few of my guys. Actually, the CEO of my company, he actually developed thyroid cancer. Mm-hmm. And I think, we were talking about, the neurosurgeon that we were both talking about earlier. And it's very interesting that the thyroid literally is directly right here and under your neck. And, we're all on cell phones and tablets and screens, and blue light can actually penetrate the depth of, causing a stress response to the thyroid.
Oh, so you're saying that thyroid cancer is linked to blue light exposure to the thyroid? I
think it's a combination of blue light to the neck. I also believe that you look at the patient who has thyroid cancer and their diet is a little bit more prevalent in carbohydrate intake. And, cancer feeds off of sugar. And when you look at these patients, they're under a lot of stress. You run their cortisol levels, it's through the roof. And, one of the things that's going to stress out your brain is actually blue light. So you can't detoxify, you're eating carbs, you can't break it down. Now you got a breeding ground for underlying fungal or, even mycotoxin exposures, and can't detoxify. And then your left frontal lobe goes underactive and you can't suppress tumors. And boom, you get cancer.
Okay. And speaking of cancer, would you say parasites contribute to cancer?
1,000%.
Because I definitely would.
1,000%. Yeah, I think that, I think with mold, I think what you kind of see hand in hand, parasitic infections, heavy metals, underlying other co-infections, those things are all prevalent. But, just from a neurological background, I think that the sinus-brain connection, to me, is the thing that functional medicine practitioners are missing. And really anything can get into the sinuses, bacterial, viral infections, even parasitic infections. You can literally go into, a swimming pool, or you can go into a river, and you can actually contract literally a parasitic, infection from swimming. So I think that is going to be the future of neurological degeneration. When you look at neurodegeneration, I think the biggest future is going to be actually sinus brain health, because there's the sinus brain and there's the sinus gut brain. And, I think we all know the gut brain health is real, but the sinus brain is definitely underlooked in so many cases.
I agree. I made a post about this. Okay, you have a leaky gut, but what about your leaky ears, nose, and throat? Because I actually believe it's worse, and it's harder to treat. There's not enough products, and there's not enough experts.
Yeah, well, and this is the interesting thing, is that a dog never needs a veterinarian until that dog comes inside. And what happens is once that dog's under artificial light, the dog gets sick. You open up the door, what does that dog want to do? It wants to run outside. And violet light, we've learned this in, microbiology labs. We would literally use a, UV light wand to sanitize our disc, to clean up everything. And UV light actually kills pathogens. So you get UV light from the sun. And, that's a big thing. We do that a lot with our patients. We use violet light over the sinuses. We laser the violet light over the ears. We laser it over the throat, in the mouth, over the gut, even the liver. Even skin will laser over infections. And what we're seeing is that, patients are getting better by using violet light to, the sinus and the gut and any type of infection.
It's non-invasive, non-pharmaceutical, completely holistic.
Correct.
Perfect.
Yeah, it's easy. It's just a light that, we put directly over the area of inflammation or stress or an infection.
Parkinson's, it's on the rise. Do you believe that mycotoxins contribute to Parkinson's, or what have you seen from your experience in practice?
Yeah, well, I think that Parkinson's, when you look at the whole aspect, what we're seeing is we're testing for mycotoxins. We're seeing mycotoxins specifically like ochratoxin A, which has been proven to actually target dopamine receptors. And it actually targets the basal ganglia, which is where Parkinson's, people have tremors from. The other interesting thing is we actually do a vision assessment. So Parkinson's patients, when you look at an area of the brain called the midbrain, you have a couple of things. You have eye movements, vertical eye movements, diagonal eye movements, even convergence, and your pupillary constriction. So what I find is the patient who has Parkinson's, that when they go to walk, I'm doing an assessment, like a gait analysis, the arm that doesn't swing, the opposite pupil is actually dilated. And what's very interesting is there's actually there's a tract from the brainstem. It's called the rubrospinal. It comes from an area called the red nucleus in the midbrain. And what it does is it innervates your proximal flexors, so like your right shoulder, your right hip. And if you have a really big left pupil, that area is actually going to be weak. So the next thing that's going to happen is you're going to see that the right arm is not going to swing. And predominantly Parkinson's patients mostly have tremors on the right side. Now, what's very interesting about that is the left frontal lobe in autopsies, actually when they go to stain it, has a lot of dopamine receptors. So when we scan their brain, we see a lot of underactivity in the left frontal lobe. So what's happening is we do a visual analysis of cranial nerves. Like we look at their facial tone, we look at their head tilt, we look at their vagus nerve, and they have all these weaknesses along their brainstem, these cranial nerves on the left side. And so sensory input drives motor and brain development. So over years worth of the brain not getting proper input from the brainstem, and then now you see these infections that add up, all the inflammation is going to hit the brain and the brainstem. And these patients, they're basically taking their prescriptions dopamine. So they get prescribed dopamine, their tremors kind of stop, but then they start coming back. So they got to get a higher dosage. And we're looking at the whole picture: stool samples, urinalysis, neurotransmitters, mycotoxin, looking at all the different infections in the blood-brain barrier. We're painting a whole picture that there is so many things going on in this neurodegenerative disease. And it's not just take this drug, but mycotoxins do play a part, in my personal opinion.
Would you use cerebrolysin in a Parkinson's patient?
First thing that I normally do with that patient, I'm very big into methylene blue. So we actually do methylene blue to start trying to calm the inflammatory response down.
An IV?
IV.
Okay.
I actually have seen Parkinson's patients respond pretty well to IV of cerebrolysin.
I've treated someone with Parkinson's using cerebral and we've seen very good results in London.
Yeah, well, when I got this patient, I was kind of nervous initially to try to use cerebral on him, but we did, and we actually were able to, in 16 hours, we were actually able to get this Parkinson's patient to literally stop his tremor, and actually by the end of the week, the guy was actually eating a steak with a knife, cutting it without tremoring.
Yeah, it's amazing.
It's been crazy.